Welcome back to your Daily Dose. My name is Robert, Susan, and by now Indu and Bradley, all talking about wellness and phases within Parkinson's. Last we were talking there was about support groups and about how people reach out. Brad, what has been your experience in those regards? We heard you talking about your mom and dad a little bit. What about you?
Yeah. I think, I want to touch on one thing that Indu said that was so important, and I could see, Robert, that it was resonating with you, was this idea of people like you, right? Connecting with people like you. And we're in the process. We're just finalizing a paper we did on a needs assessment for young onset Parkinson's community. And one of the top needs they had was a need for a group of people like me, right? Because we see that problem. If you're 35 and you're diagnosed and you go into a support group and everybody in there is 75, and sometimes that's not real exciting to go and be a part of that, right? And so I think that that's a critical component. The other thing that Indu has introduced me to that fits right in this model is the idea of social prescribing, right? What do we do? What do clinicians do to help their patients become more involved and avoid this trap of loneliness and social isolation, which she and I have written on, and it's so problematic. Right? We know that the negative that goes along with loneliness is as bad as obesity, alcoholism, and smoking combined. So we know that the health effects that this has, and how do we most effectively help these people with Parkinson's get connected with a group that they can not only be a part of, but thrive as being a part of. And I think that's, as I look, you asked Robert, starting with about my mom and my dad, that's been an area that they've struggled with. They're in the panhandle of West Virginia outside of DC, and there's not a lot locally for them to choose from. And I think that unfortunately we do get, and Indu mentioned this, we get in groups where, I think you even mentioned it, Robert, where it's a negative. We're talking about all of the bad stuff associated with Parkinson's disease, and we don't need help knowing what those things are, right? Everybody knows what they are, but what can we do to improve outcomes? What can we do to make tomorrow better than today, even if it's just a little bit?
I agree. And Susan's got something. Go ahead, Susan.
Well, I can posit a pie in the sky dream, which is to get the wellness providers tuned in to this level so that they can then offer it to their patients from a knowing standpoint. Just say support group doesn't really mean anything. And it's a little scary for Robert and me. You say improv and you scare people off too. But if you think of this work that we do as an exercise to help with your mental health, your quality of life. So getting that word out and getting the people that first see the people with Parkinson's, the patients, that's a big ask. Don't know how to get there.
I think there's something that may be happening positively. Indu mentioned this earlier about a flattening because of COVID, that there's a greater understanding of what mental health issues are. We heard the Surgeon General just last week really come forward with this. He's been doing good work, but even more so speaking toward this is perhaps the biggest problem post-COVID. We're not quite post-COVID, with realization of whatever this phase of COVID is. That we all understand that, and no less a person than Ted Lasso was at the White House. I don't know if you saw that, where he was prescribing basically the need for more conversation about mental health. And just as a side note, Jason Sudeikis, who plays Ted Lasso, is an improviser, is somebody who, really built this unique show where kindness and visibility and vulnerability mattered, not just at, in this case, the patient world, but in all levels. That means top, middle, and wherever the stratification where people might feel themselves at is to say, let's level that out and say everybody needs to come to the table together and feel both equal participants in this process, so that, again, the stigma is taken away, so that nobody's waiting for a cure, that instead they're empowered, as I heard you say, Brad, to live the best they can today. And that means, yes, facing the rough stuff too. It's not negating that. It's just facing it in an empowered way. Yes, I have this issue, and here's what I'm going to do about that. This is where I think the social prescription and you talked about this in the loneliness perspective, being visible and vulnerable to put that out to fellow people and go, have you thought of? And all of a sudden people go, that's amazing. I mean, I can't tell you how many times people don't know about a speech language pathologist as part of their program, don't know about physical therapy, don't know about what a social worker could do. And it's like, wow, those aren't part of your regimen, and yet they could unlock scores. All right, that's this moment right now. I want to open it back up. Are you guys good to hang out for a minute? Do you have time for another? Wonderful.
For sure.
All right, we'll be right back with your next Daily Dose.